Hi, we are excited to introduce our application developed by Careadise with a clear vision for the future of accessibility and inclusion. Our goal is to transform the way people with special needs access healthcare, spaces, and opportunities, ensuring equality and dignity for everyone. Knowing what medical condition a patient has requires the application of the fine art and science of diagnosis. This knowledge helps guide treatment interventions and management strategies, and can also help predict outcomes and prognosis to a certain extent. However, although diagnosis is valuable, it is not sufficient on its own for understanding the full picture and the lived experience of a patient when being discharged from the hospital or being mobilized from home. Here at Careadise, we believe in the wisdom that says there are no diseases, only patients. People generally seek health services because a condition makes it difficult for them to do what they used to do beforehand, because they are disabled, rather than because they have a medical condition. Here comes Cuido, an accessible and inclusive digital platform that connects patients, families, and healthcare professionals in one inclusive ecosystem of care. The application provides measured information for an interoperable and inclusive communication platform, a risk and hazard coding system that enhances accessibility at home, an inclusive predictive profiling algorithm to anticipate complications and hazards in care, an interactive scheduling supporting system to ensure accessible healthcare appointments are complied with, a long-term care plan with inclusive monitoring and traceability, a 3D home scanning tool for accessibility and safety improvements. In short, Cuido transforms hospital discharge and mobilization of patients into an inclusive, safe, and accessible journey, guided from start to finish. But how does it all work under the hood? Behind the application lies the Virtual Care and Remote Home Control Center, VCR-HCC, which ensures a digital backbone for data management, patient database, standardized digital forms designed for risk observation and mitigation, medical, functional, and cognitive data stored with accessibility in mind. Predictive risk algorithms. Patients are evaluated with the model effect times exposure times probability equals risk. Action priorities emphasize risk stratification and accessibility in healthcare delivery. Accessible 3D home scanning module. Homes can be 3D scanned with Matterport to visualize necessary home adaptations for informed decision-making. Integration with assistive medical devices. Assistive medical devices, such as blood pressure monitors, glucometers, and weight scales, send data wirelessly and are stored for trend watching. Accessible dashboards and alerts make this data usable for all. Alerts and task management. Clear, accessible alerts notify family, doctors, and caregivers when goals are not met. Back Office Manager Panel. Algorithms and coding systems are adjusted through a data review approach. Third-party API integrations, such as AZV Insurance, ensure inclusive connectivity. Big data learning curve development for demographic senior care management. Aruba can better understand and prevent unforeseen medical setbacks at home, reduce hospital readmissions, optimize scarce resources, and most importantly, build a data-driven digital healthcare ecosystem. More than an app, it is a platform designed to ensure a safe and secure transfer back home and a higher quality of life, where no one is left behind.